Hi, my name is Debbie Komisak. I'm doing this video presentation on the Case Management Implementation Plan. A case manager in my place of employment would be a great asset to the facility. I work in a very large pediatric clinic with 12 providers, and what they tell me is 30,000 patients. I would use the case manager to manage our asthmatics as my chosen illness. Pediatric asthma is a common morbidity and involves a lot of teaching and maintenance for the patient and family. I would have the case manager or managers be assigned to all the known asthmatics in the practice. His or her core responsibilities would be to oversee those patients in such a way that they will be brought in for education. Primarily, they will be educated in the pathophysiology of asthma. In layman's terms, the manager would use visuals and handouts for the families to take home with them. Proper use of medication and the use of spacers and quick-acting medication and long-term medication will be emphasized. The importance of compliance with the medication, routine checkups would be emphasized. And I would follow up with them either by phone, house visit, or bring them into the office to review the teaching. The case manager would make individualized care plans for these patients. She would also individualize asthma protocols using the green, yellow, or red light as an indicator, and have corresponding triggers and remedies for those colors, those particular colors that are needed. She would give examples and follow up with them either by phone or bring them into the office to review the teaching. The case manager would also ensure the payer covers all their needed medication. If they're asthmatics, if they're special needs children, the case manager would also make sure that the patient has proper DMEs, such as a vibration vest, if that would be ordered. I would also have the case manager follow up with our ER reports or urgent care reports. They are faxed to us daily, and I would have her keep track of the patients using these facilities with a diagnosis of asthmatic exacerbations, and she could follow up by following up with those children that are in the ER urgent care. She could see who's perhaps not being compliant or why they have exacerbations, and maybe be able to teach them a little more. The education will focus on knowing and avoiding triggers that participate in asthmatic flare. They will be targeted to use various medications such as rescue inhalers and long-term inhalers, and the proper way to use them with the spacer, the importance and compliance of the medications. The case management goals would be to promote patient and family satisfaction by providing quality, cost-effective care as evidenced by increased patient satisfaction surveys. Involvement of patient and family in devising a patient-centered care plan. Serve as an advocate and teacher for patient by intervening to them with payer and the DME provider to evaluate monthly and to ensure quality care is being provided. Disease-specific goals is I would have the patient will have decreased need to utilize the urgent care or ER due to the asthmatic symptoms. The patient will not have any limited playtime or school limitations due to an asthma flare, and patients will verbalize understanding of disease process, triggers, and the treatments of their asthma. I work in a clinic that was once private called All About Children. However, they were bought by Penn State Health, which is a big corporation that owns a lot of medical facilities and hospitals. and that happened a little over a year ago. Adding a case manager to the practice would involve stakeholders such as the CEO and COO of Penn State Health on a large scale. And within the practice, I would say the office manager, clinical manager, and the providers would be stakeholders in the case management decision. People who would support my plan would be the clinical managers and probably the providers, since they are clinically knowledgeable and would understand the necessity and benefits of having a dedicated nurse or nurses to address this population. Using a case manager in the facility might even lead to alternative care or increased care of others with high needs, such as the diabetic. They could start with a asthmatic case manager and perhaps go on to other case managers to oversee other diseases, such as diabetes, or our children with special needs who have multiple coexisting illnesses. The need is definitely evident, and using a case manager could improve the facility. Primarily, it could improve the patient health and also financially gain the facility as a good asset to the practice.